One of the concerns for many people is that they don't want to go to another doctor and spend more money to find that the doctor can't help them. What I want you to know about your first visit to me is we're going to isolate your problem. We're going to tell you on that visit whether we have a solution for you. So by the time you walk out of our office, you can receive care and get the help that you need if we're the place to help you. So what I want you to know about that is I'm going to do everything I can to help you find an answer and solution to your problem, just as if you were my mother, father, brother, or sister. So one of the first questions I have for you that I ask every patient on their first visit is, how committed are you to getting well? In other words, if I could possibly find and give you a solution to your health problems, how committed are you? So on a scale of 1 to 10, 10 being the very most committed, what's your number? I want you to think about it now and be prepared when I see you to answer that question. Is it a 10? Is it a little bit more mediocre, like a 5? Or is it real low, like a 1 or a 0? If it's below a 5, we're going to have a lot of discussion about that number. I want you to be committed to your health. In other words, if you ask me the same question, Doc, how committed are you to helping me getting well? And if I said to you, I'm a 5 or maybe a 2, I expect you to run really fast out of my office because I'm not committed to helping you get well. So you have to have the commitment level for yourself. So on this first visit, we're going to get to know each other, you're going to get to know our office, and we're going to determine whether we can help you. So one of the other questions I'd like you to think about is, how long have you had some of these health problems? Not just the one that you're talking about coming into me for. Not just the pain in the neck, not just the back pain or the sciatica, but do you have other things, other health conditions that you want to get rid of? Do you have irritability? Are you depressed? Do you perhaps have numbness and tingling in the hands or in the feet? Do you have insomnia? Do you have sleeping disturbances? These are some of the other questions that we're going to be talking about. In other words, I want to help you with your whole health package, not just the one pain that you might be thinking that chiropractic can help. We do a lot of things in our office, including nutrition, detoxification of the body. We do bone density testing, and many, many more things that I'll share with you later when you come to the office. But for now, just know that there's a host of other things that we can do to possibly help you to get well. Not just for now, but into the future. Because I want you to be healthy now, but also for your future with your children, your grandchildren, have a healthy, happy life. So one of the things I would like to ask you is, when do you think your health problems started? Did you have a car accident when you were a child? Or you may be involved in the accident, not a driver. Perhaps you were a child and fell out of the car. That's what happened to one of my patients. She was 4 years old and she fell out of the car. Her health problem started then. Even though she didn't remember she had fallen out of the car, her mom had to remind her of that. So another question is, what else are you doing to help get rid of some of your health problems that maybe hasn't worked for you? Have you been on over-the-counter medications? Have you been on prescription medications? Perhaps you've tried acupuncture. Perhaps you've had an MRI, a CAT scan. Anything like that that you can tell me to rule some things out, then we'll be able to determine what will work for you in the future. I need to know, what activities can't you do anymore? Perhaps you used to like to play tennis and you can't play tennis anymore. Perhaps it is as simple as quilting and maybe you can't quilt any longer. These are some of the activities I need to know that you can or can't do. In other words, not just the job-related activities, but maybe the things at home or the leisure activities. Those are important for us to know. I also want to know, how do you feel? Not just physically, but how do you feel mentally about this? Are you discouraged? Are you frustrated about your problem? Also want to know how many medications you've been on, or any nutritional supplements that you possibly are taking. In other words, anything and everything that you've done to try and get rid of not only this pain that you're feeling right now that's bringing you to my office, but about your entire health. I want to know what you're doing and what you've tried that maybe hasn't worked for you. I also want you to consider this. How do you feel right now in terms of your health age? You may be 25, you might be 35, you might feel like you're 90. I want to know that, and I want to know why, so we can answer that question for you and provide a solution to you. I'm really happy to have visited with you on some of these questions. I hope it helps you to have the best possible visit with me that you can have. So I look forward to actually seeing you in my office, giving you a tour of the office. My staff looks forward to welcoming you. If there's anything else we can do ahead of time, you please let us know. Otherwise, I'll see you at the office soon.